what else do we got here? So I was going to talk a little bit about prolapse, just because Dave seems so interested in my pessary fitting kit here. Prolapse. So there are many types of prolapse which differ according to which organ is affected. When the walls of the vagina become lax, the organs that they should be supporting bulge into the vagina, creating the sensation of a lump hanging down. Now, some women will not feel it. They may have, a lot of our patients don't know they have it till they have their yearly well exam at their primary, and the primary is like, oh, and then they connect the dots with all past symptoms and realize they should be at urology. So then they come and we kind of treat them or help them, see what they need going on. The uterus is supported at the top of the vagina, and when the ligaments in the wall loosen, the uterus bulges down. This condition is called a uterine prolapse. So that one is this bottom. So it's just the cervix. I don't know if any of you guys worked in nursing homes. My first prolapse was in a nursing home, and I went to change a brief, and all of a sudden I see this coming out. And I was like, no way, she's having a baby. Like, I had no idea. I had to run and get the nurse on charge, and I was like, what is this coming out? Yeah. By the time I came back, it was back in, so she thought I was crazy. I was like, no, there was something coming out of her. So now that I'm in urology, it all makes sense, because I kind of just stayed quiet after that. Yeah. Okay, maybe I was noxious. You never know what you see. Other types of prolapse include prolapse of the bladder into the front wall of the vagina, which we see a lot of. Where was I at? And then the rectum. The rectum can fall into the vagina, which bulges into the bladder area as well. So all this pressure can keep your urethra more or less to where they can pee a little bit if they're full enough, like overflow, but if it's not causing the bladder to contract, the rest of the urine will just stay in the bladder. So if they don't have a longevity of their contraction of the detrusor muscle, it's not all going to come out. So a lot of the times before we see these patients in clinic, they've already got labeled as a history of urinary tract infections because they haven't been emptying their bladder. They're not on any hormone therapy. They're through menopause, so they needed estrogen to thicken up, you know, some of the skin layers. Some of it's not always just weak muscles. It's thinning of that lining that we need to protect the muscles to hold it all in place. So sometimes we don't necessarily do the uterine ones, but our doctors will go in with the other, like OB doctors and so forth, gyno doctors that and assist on the surgery, because like if they do a hysterectomy, our doctor will go in with them and do a sling at the same time just to prevent future stuff. It totally depends on the doctor that's doing it, what the patient wants, what their future holds for them, you know.
How long do slings last?
It totally depends what kind of sling you had. It totally depends.
Old slings are not as dependent as new slings?
What's that?
Are old slings not as dependent as new slings?
That answer I don't know. I would say probably not, because everything gets better with time.
That's okay.
That's what they say.
They say.
Yeah, would not agree, except for bladders.
I know that we use different, like mesh than, obviously, than they used to. That caused a lot of people trouble. They were using it before they should have. It wasn't approved for these things. But we do a lot of urethral slings, mid-urethral slings. So that's where there's like, see, this is a normal bladder here. So that's where the urethra kind of bulges down a little bit, you know. It's kind of like leaving a hose on too long and it gets that little bulge off to the side. It could spring a leak. What causes the pelvic organ prolapse? Pregnancy, labor, childbirth, the most common causes. Obesity, respiratory problems, elderly people with COPD or something. Yeah, cough and cough and cough, especially if they're already like chair-bound, bed-bound, anything like that. They're not up and they're not moving, they're not doing their Kegels. Constipation from straining too much, that's how the rectal ones, even pregnancy can mess up the uterus one, but so can being constipated while pregnancy, and then you can have a rectal prolapse.
Costco has the squatty potties too.
Oh, that's right.
Do they? I was actually going to look into that. My kids need one.
Oh my, you don't know what the squatty potty is?
Oh,
Where'd you get that?
You're going to have to get
Right.
You'll have to have GI come in here next. Has GI been here? Has GI come?
No.
You gotta have McCullough or
Yes.
somebody come do something. They might.
Mm-hmm.
Let's see. Oh, another cause, just like I mentioned, surgical removal of the uterus, because if you take out that big of a part of a woman's down yonders, things are going to fall in. And if they don't grab somebody else, like my doctors, to go help them put it all up, you're going to have problems. Inevitably, you're going to have problems with all of that falling back down.
I have a comment on that. I have a brother who's a nurse anesthetist, and his recommendation was you see a urologist first, then you see the gynecologist, because the gynecologists, when they do the hysterectomy, think they can fix everything, but you really want a urologist to fix it. So you see the urologist first, and then you get your, he will or she will work with your gynecologist, but if you get the gynecologist first, they don't
He may
know
not
where you-
ask
Right,
for the
yes.
help.
Yeah.
Right.
Oh,
Yeah. Yeah.
So go for the,
I've seen a lot more lately with our doctors working hand in hand with other doctors, even to go in and put stents in the ureters so that not only can everything keep draining, but if something, God forbid, gets nipped, they can see the stent in there and they know what it was. And they put it back together real quick,
Interesting.
hopefully. Yeah. Symptoms of prolapse would be pressure, fullness in the pelvic area, an aching lower in the back, painful intercourse, a feeling that something is falling out of the vagina, urinary problems such as leaking of urine or a chronic urge to urinate, constipation, spotting or bleeding from the vagina is kind of one sign that we see. Incontinence or retention symptoms because the prolapse is blocking the exit of urine. So medications, typically no medications for prolapse. There might be the estrogen therapy for women, but there really is no medication to fix a prolapse. Physical therapy to help with strengthening the floor muscles, because if it's not too bad, you can correct it if you catch it. That's why Kegels are super important. You see a stop sign, you squeeze till you get there. That's what I tell my patients. You see, you're at a stop sign, you're at a stoplight, you try to get a few reps in before it turns green. Nobody's gonna know, and you did your workout for the day. Men can do it too.
On my motorcycle?
Just kind of get up for a minute.
Yes, Dave.
Men can do it too, because you know what? Most of the men versus women after surgeries have leaking issues because they've ignored that muscle. So we send them to physical therapy. A lot of them just laugh it off, but it works. Men can do it too. Yeah. I have a device here I was going to show you guys. It's called an Intone. It's kind of like a biofeedback. I don't have the whole computer here, but I thought I'd not pick on, but bring some men and female stuff that we deal with in the clinic. Pessaries, you can use pessaries. That's what this big kit is. There's all sorts of different kinds of pessaries in here. And those are placed inside the vagina to help hold up whatever prolapse may be falling down. It's usually used if younger women aren't done having kids, you know, don't fix it yet, I might break it again. Or they're too old. They can't go under anesthesia, or it's not bothering them that bad enough to go and do a surgical option. So this is the Intone device. I might as well just show you while we got it here. It's just like that.
Comes in.
Yeah, so the girls are in our lobby with us, we know what they're getting. So this is, don't worry, these are literally demonstration only, so if you see something on it, I promise. I've never been used on anyone. So we have a little laptop at work that is reserved just for Intones, and your patient, when they come in, they have this device and a little box here that kind of talks to them. I don't know if this one's charged up. This will plug into this, and they'll do their exercise at home. They come back, we plug this into our computer, and what it's going to track, yeah, it's going to track their progress. So basically, inserts into the vagina. There's an inflation rate, so this guy is going to get bigger, and you're going to want it to kind of seal off the vagina opening because you want it snug. You got a little stimulus plate here, and that's going to kind of give, I don't want to say shock, a little sensation. It gives a little
Zing.
You know those old school belts people used to put on that would sit and shock
Oh, yeah.
you, and you would think you're exercising?
Right,
It's kind
yes.
of like that.
Ooh, no, that's so nice.
But you gotta hold it. You gotta hold it and listen to it so it will count to you. And it
Ah.
can see how tight you're squeezing, how long you're able to hold. It will tell if you're quivering. Watch when you guys get out of here and do the stop sign thing. See, you'll quiver because you're not used to it.
Only if you're doing it correctly.
Ah.
Or if you're not used to doing it.
Yeah.
Yeah. But it will tell you, it tracks on the machine, so we can tell them, well, you know, you're getting better, or you're able to hold on longer this time, and you can crank up the stimulus. We have to set that, the patient cannot, because these are guaranteed, which is another reason why we track them. They're like $700. But if they come back and they didn't do it for a week, and let's say in a year they're like, it didn't work, well, the company won't refund them if we don't have the record of them doing their program as they were instructed to do.
It's kind of like a compliance.
Oh, yeah.
Yeah.
It should be.
Yeah, so that's that.
Listen, earlier you showed me on those pestries how, maybe you can just do a little quick thing.
Oh, yeah. Yeah, so these are different types of pessaries here. Pessaries are generally made of inert plastic or silicone to prevent odors and absorption of vaginal secretions. Silicone pessaries can be autoclaved. Again, I promise you, these just came out of the autoclave. I promise. So, different ones. Let's see. Where did I write that? So supportive or space occupying in nature are some like these big guys here, here, or here. I don't have one of these. You put that into the vagina, you kind of pump it up till everything gets up where it should be, and then they take the nozzle off. These ones are more like the same idea, but you can't change the inflation. So they're space saving.
Donuts.
We don't use these ones. That's what they're called. They're donuts. We end up using more of these ones
Donut.
with support. When they have the middle here, it's with support.
Huh.
Diaphragms. Yeah.
Basically, yeah, these ones, I don't know if I have the actual diaphragms in here. Some of these that have little nodules on them are made to occlude the urethra, kind of, sort of, put in there. Well, those are stents. Okay, where's that thing? So, we can just pretend this is kind of a horrible little diagram to be using any of these on. 5 is most common size. So to put these in, and the MAs do this, a patient will come to clinic, they want a pessary, so we got to size them. We don't know what type they need yet, we just kind of have an idea of what kind of prolapse they have. And they get like a 30-minute or more office visit. They come in, we start sizing, we have them walk the halls, go sit down. I don't know how many of these I fished out of the toilet. They'll sit down, and you know, because they got to do their normal daily maneuvers to see if it's going to work. We try to get them to have fuller bladders just so we can see how it feels and things like that. Are they able to pee with it in there? Is it pinching in the wrong spot? Things like that. Man, we've gone through this whole box one time and this lady was not happy. So it totally depends, but the way you put these in is you kind of got to bend them in half. They have some special lubricant, which makes it difficult to keep it held like this. And then you slide it in and you just kind of let it pop open, and it just holds it. These horn ones are difficult. These are difficult to get. These are difficult to get in, but they kind of go in. Not like that, but that part's made to hold everything up, and this rests against the pubic bone.
Oh my goodness. Yeah, that seems like
Those are those ones. They come in monthly and have them cleaned if they can't do it themselves. Sometimes I try to push it on patients to do it themselves, and like I'll get tooth floss and tie it to the hole so that they can pull it out when they need to. like a tampon. Speaking of tampons, have you guys seen these Poise stress leaks commercials?
Oh.
These are like a tampon.
I don't use it anymore.
But they
And-
like something that.
No, these are different. You put it in like a tampon, but it's made to occlude, like block the urethra from stress
Yes.
leaks.
Yes.
Oh.
Yeah, it
So
goes
it goes
in.
in and out.
Interesting.
Uh-huh.
These only work if you're kind of catching it in the early stages. If you're prolapsed, it's not really working. Stress leaks from the
That's for
urethra.
prolapse or like stress incontinence?
Ladies have been using for both, mostly stress incontinence.
Okay.
Yeah, because it stops things from falling out.
Yeah.
It's not really what it's made for, but yeah, it stops the
So
stress
these good old
incontinence.
sneezes.
Yeah.
Interesting.
Huh.
When you went to the center.
And they're poison, they're,
Exactly.
you don't need a prescription then.
No,
You
you
just buy 'em
don't.
at the,
But if you've tried a few things, I'll get your insurance to pay for it.
Ah.
Give me a bad day, get me on the phone with a
Yeah.
rep. I'll get what we need.
Can you
Um,
use any of these when somebody's still pregnant? Because you know a lot of women.
Yeah,
towards the
actually,
end-
because if you can't have surgeries, you're pregnant, a
Right.
prolapse might be bothering you or something, you can use these. You can use the tampon, just want to make sure allergens right.
Oh,
You don't know what
yeah.
your baby's allergen is going to be.
Yeah.
But these, nobody should be allergic to these guys. But who knows what's in this? Right? Some tampons irritate people. I'll pass it around. It's got like, it's like a hard silicone tripod thing in there.
Yeah, give it to Dave.
Figure all these things out.
This looks like torture.
We haven't gotten to ED yet.
Well, we're looking forward to it, guaranteed.
So I was just gonna,
I was expecting it to be soft.
Right, expected it to be soft.
no, no,
Yeah.
no.
you know, because you don't feel that, right? Because it kind of boings out of this.
I like that.
It's collapsed in there, so you don't really feel it at first. They encourage trying everything at work.
Oh, yeah, absolutely.
Yeah.
Yeah. Yeah.
So
No,
you're-
but I just
You're
pulled
boring it from
those.
experience.
No, I have not tried these. I did a urodynamic. I've capped myself a few times. I've used those Poise things just because I was like, that doesn't make sense.
Right.
So I snuck it. And then now I can educate any of my
Right,
patients on how it's
exactly.
supposed to feel.
Yeah.
So, yeah, I guess we can talk about stents. I don't know. I guess my thought process of bringing up stents is after we place a stent in somebody, they have a lot of concern and complaints and discomfort. Not everybody, but some people do. And if they have a concern, they have every single concern you can think of. But I thought showing you guys what a stent is in case you guys are at a clinic where maybe they couldn't get a hold of us or they called the wrong office with stent discomfort, then you'll kind of understand what. There's not much you can do about the discomfort, but educating my patient on why they're feeling what they feel has pretty much treated them alone. So a stent is a fine piece of plastic tube inserted into the kidney. It allows urine to drain from your kidney into your bladder when you have a blockage, a stone, or a growth. Sometimes after kidney stone removals, like Dave had one, and it may be due to an obstruction. You might have hydronephrosis. They want to keep the fluid draining out of your kidney. Or you could have inflammation from like lithotripsy or going in there with a cystoscope or a ureterscope and basketing a stone out. So it's kind of put in there sometimes as precaution or as a preventative, or like down here, just some people have a history of renal failure and get these replaced every 3 to 6 to 9 months, totally depending on what their situation is. Typically, if there's a stone, we don't put one of these unless they have like severe renal colic, pain in the kidney area, sepsis, pyelo, something that we just need to get the kidney draining. But as you can see as I play with it, it's really, really flexible. And it goes, one side is in the kidney and one's down at the bladder. And it looks like a soaker hose you'd see in a garden with a bunch of little holes around it that just allows the urine to keep coming down. Some people go home with a little string attached to the end of it that's hanging out the urethra, and they'll be instructed to pull it themselves. But if the doctor doesn't think they're capable of it, he just doesn't leave a string, and then it's hanging up in here. Then they gotta come to clinic with the scope we put into the urethra. We feed a little grasper through the camera, and we spot it, we grab it, and we pull it out. Feels like pulling a Band-Aid. I've heard that a few times now. We just did a double pull
No,
today.
they don't.
You did it yourself, though. Dave was trusted, so he went home with a string.
HIPAA.
But
It's
it
not a
helps.
Band-Aid.
Men have longer urethras.
Rip it off.
Yeah.
Take a big breath.
So the biggest complaints we get from patients is blood in the urine. Yeah. We are honestly never too concerned with blood in the urine unless it's a high red blood count with micro. The doctors don't even really fathom like the 2 to 3 counts, because tests like that are designed to pick up anything. They don't want to miss anything. So a lot of the time you'll see red blood count 1 to 3 when really it's probably nothing. But those type of tests are just designed not to miss anything. So let's pick up something. And a lot of them are color detected. So if they took pyridium, which I don't know if you guys know what that is,
Good
azo
gracious.
turns your urine orange. It's gonna change that color on the dipstick, and it's gonna look like there's blood in the urine, but it's just the pyridium. So we'll get complaints of blood in the urine, bladder irritation frequency, because this is super light. And think about it, if your bladder's full, this is floating in there, and it's banging the walls. Even if your bladder's not full, it's setting off those sensations that you need to urinate. So they go to the bathroom, and it's like, really, that was a drop. So there's medications we can use to help calm the bladder down temporarily, like oxybutynin, Flomax sometimes. Flomax is usually a male medication, so we'll get phone calls. Are you sure you meant to? Yeah, we meant to prescribe it to a female. It just relaxes the smooth tissue lining of the ureter and the bladder and things like that, just to try to forgive that the stent's in there.
So what is the time frame of having a stent in? Would someone have a stent in permanently or?
Some people do, but they gotta exchange them. Stent exchange. Yeah, if they go overboard, this thing could be encoded in stones or sediment that calcifies, and then think of pulling that out. Yeah, we've had a lady that she had gone way too long, but it was so painful. She didn't come because she was afraid of the pain.
Oh, no.
But then it was way worse. So I think they ended up taking her under for that one. You can do it under. The placement's always done under. The pulls can be done in clinic or at home. Yeah.
Have you ever seen a ureter occluded by pregnancy?
No, not me personally. I don't recall rooming anybody either. I mean, I'm sure it could for a moment. Baby.
I think I did for a week.
Really? Did you have pressure in the flanks?
Oh, I was in a lot of pain, and they did an appendectomy just in case, and I was getting a stent in, but I woke up that morning without the pain, and they...
These are some things they can do to pregnant people to help relieve symptoms while they're going through pregnancy, so that when the baby pops out, they can go get a stone procedure. We see actually a good handful of pregnant women with stones developed after being pregnant.
So this was pre-MRI, all they could do was an ultrasound, and they couldn't really see a lot.
That's why they put a stent in, sometimes even out of caution, because if the ultrasound won't be able to show, because you'd only see that with contrast, the ultrasound would show probably like a shadow over the kidney, which would make them think there's fluid on it. And then they may put a stent, depending on the symptoms too, just to relieve. Huh?
How are they placed?
They are placed, these come straight in kind of a tube, and it gets fed through the camera. So kind of like taking a tampon out of a tampon container, you push and kind of pull at the same time. So they back the camera out as they're pushing this in. Yeah, they make sure the curl's in the kidney, and then this is in the bladder. There's a couple different ways these come, but that's the most common one that I see, because I don't go up to St. Joe's in their OR.
Yeah.
So it's whatever I get to see in the clinic. Yeah. Oh, that last picture was just, they also have like ureteral catheters that are placed kind of like a guide wire, but those get pulled out too. Those are usually there for surgical things. All right. Erectile dysfunction. I never knew urology dealt with erectile dysfunction. Did any of you guys knew that? Like, we as women go to female doctors for female things, but nobody thinks of where do men go? A lot of men don't even know there's somewhere for them to go. The first time I roomed a patient with the abbreviations ED follow-up, I was gearing up this office visit for a hospital follow-up. And the doctor I was working for was super comical at the time. He's like, well, go figure it out. Why is he here, Melissa? Well, you know, and I'm sitting here like asking ED questions, erectile dysfunction, or ER department questions, and the patient's hinting, no, like, ED issues. And I came out of the room, my doctor was like, that wasn't funny. But it's kind of cool because if you do think about it, they have nowhere to go. So
Right.
these doctors are
Carlson?
pretty. Yes. Dr. Carlson, he was pretty awesome. So erectile dysfunction is the inability to achieve and or maintain an erection hard enough for penetration. Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Erectile dysfunction can result from a problem with any of these. Likewise, stress and mental health concerns can cause or worsen the erectile dysfunction. So if someone has like a high blood pressure issue, which can give you an ED issue, they may go into their sexual acts fully erect, ready to go, but then in the back of their mind, they've got the anxiety that they know they have this health condition. It may not last the whole course of this sexual act, and then it doesn't. So then they have the psychological issues of it as well. So there's multiple ways to treat it. Basically, trying to figure out the root of the problem is kind of hard. You know, if you don't know their whole health issues, especially at specialty. If they come from a clinic that doesn't use the interface a lot of us use, like Care Associates, they have their own. So unless they sent me every single chart note and with all of their diagnoses and stuff, my doctor and patient doesn't omit, we may not know they have high blood pressure. You know, it's all on the patient who tells us stuff. Some patients might lie to us and not tell us they take nitro.